We know that vitamins are very important for our body, but do we consume enough of it? Unluckily, not all doctors are rich as well. But it is very important for us to at least know to have a balanced diet. Therefore, it's good to study about vitamins not only for the exam but also for your life and for the welfare of the patients. Let's go. We will study biochemistry in a simplified form. This is Dr. Auroraj. Let's study vitamins. The word vita, it means life. It means life in Latin. Yes. As our body cannot synthesize vitamins, we need to take it from our diet. Yes. So therefore, we require a small quantity from our food. Let's dive into the lectures. Let's go. Look at these beautiful pictures of vegetables and fruits. They are very colorful. If you take it, they will also make your life colorful. Look at these grapes, watermelons, cherries, pomegranates, tomatoes, we have oranges, Indian gooseberry, green leaves, we have cucumbers, broccolis. Yes, if we don't take it, then we end up taking the so-called vitamin tablets. So it is up to us whether to start taking this or this. For our FMGE exam, it is very important to know that vitamins are of two types. One is going to be fat soluble, another is going to be water soluble. The fat soluble vitamins comes with a mnemonic ADEK, ADAK. ADEK. Tell along with me please. ADEK, ADAK. And the water soluble comes with a mnemonic BC or WBC in simplified form. WBC. Yes. These are going to be water solubles. So we have fat soluble and water soluble. Stick to that. We'll study more in detail about the fat solubles. Let's start with ADEK. So these are fat soluble vitamins. ADEK. ADEK. Yes. If we don't eat these vitamins, what happens? The deficiency can lead to malabsorption syndrome with steatorrhea. Malabsorption syndrome. Remember this word? Malabsorption syndrome. Yes. Namely, what are the examples? You may have what? Celiac disease, cystic fibrosis, mineral oil intake can also cause what? Vitamin deficiencies. ADEK. Remember, these ADEK, they can be stored in the liver along with the body fat tissues. So ADEK can be stored in the liver or in the body fat tissues. Another important point to remember for our exam. Yes. Starting with our mnemonic ADEK. A. Remember, A is for antioxidant. A for antioxidant. Yes. The vitamin A is further classified into retinol, retinol and retinoic acid. Vitamin A for antioxidant. Yes. Retinol, remember, it is the constituent of visual pigment. It's a constituent of visual pigment. And retinol, it is used to treat the wrinkles of acne. They are used to treat the wrinkles of acne. And retinoic acid is used to treat the promyelocytic leukemia. Another important point, retinoic acid, it is used for promyelocytic leukemia. Yes. Look at the image of the background. If we don't eat enough of these vitamin A, broccoli, oranges, carrot, we have fish, milk and the eggs, we end up developing vitamin A deficiency, or the patient whomsoever doesn't consume of these might present to you with vitamin A deficiency. Now, vitamin A deficiency in a prolonged period can lead to night blindness. It can lead to night blindness, which is called as nyctalopia. Vitamin A can lead to deficiency, can lead to nyctalopia. Yes. Or on further prolongation, it can lead to Bitot spot. Bitot spots. Yes. What do you see here? This is called as Bitot spot. It is the keratin debris. It is the keratin debris with foamy appearance on the conjunctiva. Foamy appearance on the conjunctiva. Good. Now, further, it can also lead to dry eyes, where the conjunctiva becomes redness, it can become itching, you can see foreign body sensation and the burning sensation as well. So this is going to be called as xerophthalmia. Dry eyes is called as xerophthalmia. Very good. Or it can also lead to a condition called as keratomalacia, where there is going to be corneal degeneration. There could be corneal degeneration. This can also occur in case of vitamin A. So therefore, it is very important to eat a lot of green leaves rather than eating more of whites only rice. We should add more colorful veggies and also fruits. Now, if someone start to take more of vitamin A, knowing they are deficient, acute toxicity, remember, acute toxicity can lead to nausea, vomiting, and another important condition which is called as increased ICP, intracranial pressure. Increased ICP, intracranial pressure can also occur. In case of chronic toxicity, alopecia, dry skin, and hepatic toxicity may happen. Hepatic toxicity can also occur due to chronic toxicity of the vitamins. Yes. Vitamin D. It comes with different forms: D1, D2, and D3. D2 is called as ergocalciferol. D3 is called as cholecalciferol. Now, D2, remember, it is very good to take mushrooms, fungi, and yeast for vitamin D2. Yes. D3, remember 3 words: sunlight, fish, and milk. So these are going to be sunlight, milk, and fish. They are going to give enough of vitamin D3, which is going to be cholecalciferol. Now, vitamin D, it actually helps for increased absorption of calcium and phosphate. Increased absorption of calcium and phosphate. Very important point for our exam. And also help for bone mineralization and also increased resorption. These are also another important points to remember. Now, say for example, if someone is having vitamin D deficiency, exposure to less sunlight, this happens more on the Western countries. In our country, it is due to poor diets. Since we are a developing country, there are so many poor people who are not able to even have foods. In such a case, how could they manage to get a balanced diet? So, poor diet could also lead to what? Vitamin D deficiency, which might cause rickets in children. Rickets in children, yes. In adults, it will lead to a condition called as osteomalacia. It leads to a condition called as osteomalacia. Vitamin D deficiency in children is going to lead to rickets, yes. Deficiency can also further be due to malabsorption, decreased sun exposure, and also poor diet. In India, basically it will be also poor diet or malabsorption. This is going to be vitamin D. A, D, E, K. We have finished A and D. Right now, moving ahead with E and K. Vitamin E, it includes tocopherol and tocotrienol. Tocopherol and tocotrienol. These are few more points to remember. Yes. Now, look at these badams, pomegranates, oranges. We have pumpkin seeds, eggs, and green leaves. When we are preparing for a very intense exam like FMGE, it is good to take care of our body. If you start consuming good foods, it means you're going to also be in a good mood. Your body will be able to adapt to whatever energy you're spending with good quality meals. Rather than consuming large quantity, go for good quality meals these days. Take a badam 1 or 2 every day with a glass of milk as well. It will also help for your memory and also for your mood to be focused a little bit more with full enthusiasm. Now, moving on to topics. Vitamin E. It is also a very good antioxidant. It protects the RBC and also the neuronal membranes from free radical damage. Vitamin E protects from free radical damage. If a patient is vitamin E deficient, he may have what? Hemolytic anemia. E. Vitamin E. E for hemolytic anemia. Good. Next, we have ataxia, acanthocytosis, or also demyelination of posterior column. Demyelination of posterior column. One of the reasons to avoid giving more of these vitamin E, like badams and nuts, to Excessive intake of vitamin can lead to enterocolitis in infants. This is another important point. Remember on vitamin E. Good. Moving ahead with vitamin K. K is for coagulation. Remember K for coagulation. Yes. It is further classified into K1, K2 and K3. K1, K2 and K3. K1, it is also called as phytoquinone and phytonadione. Phytoquinone is a natural source and phytonadione is going to be the synthetic source. K2 is called as menaquinone and K3 is called as menadione. As we know, vitamin K for coagulation. Yes. So, if this is deficient in the body in neonates, it can lead to what? Neonatal hemorrhage, which might cause increased PT and APPT. Increased PT and APPT. Good. Now, it is also very much required for the maturation of clotting factors. Very important for the exam. Helps for maturation of clotting factors. 2, 7, 9, 10. 2, 7, 9, 10. Yes, please remember. Please chant with me. 2, 7, 9, 10. 2, 7, 9, 10. This is going to be for vitamin K. Okay. Quick revision. So we studied vitamins are of two types, fat soluble and water soluble. Fat soluble came with mnemonic ADEK and we have successfully completed it. Now moving ahead with water soluble vitamins, which are going to be vitamin B and vitamin C. Look at the background image here. Looks so beautiful. Bananas, strawberry, yogurts, avocado. We have broccolis, cauliflower, eggs, nuts, peanuts, walnuts, cheese and leaf. When was the last time you had such a good meal? You guys should start having this one. Not after passing FMGE. You should have it right now because you're all going to pass the FMGE exam by December 2024. Yes. So start giving a very good treat for yourself. For you are ready to work hard and to pass the FMGE exam by this year. Yes. Now, one more point you have to remember, vitamin B and C, they are washed out from the body easily. Washed out from the body very easily, except two vitamins. They are going to be vitamin B12 and B9. Two important points, remember, B12 and B9. Yes. Next, remember B12. This B12 is stored in the body at the liver for 3 to 4 years. 3 to 4 years. And B9 is stored for how many months? 3 to 4 months. It's very easy. 12, higher number for 3 to 4 years. B9 is for 3 to 4 months. So please try to not forget to treat yourself with vitamins, which is going to help you to survive for these upcoming months and get your target done by this year. Yes. Vitamin B complex. There are 8 forms. B1, B2, B3, B5, B6, B7, B9 and B12. These are very important to know. Yes. The B complex deficiency most often is seen in old age people. They are most often seen in the old age people. And also in diabetic patients, because in India we consume more of what vitamins? So the metformins. And also in diabetic patients because these patients, and also in diabetic patients because they consume more of metformin. Metformin can cause what? Vitamin deficiency. Yes. And pregnancy time. That is the reason why also we give vitamins to the pregnant female. And someone who is taking excessive alcohol, they may also develop what? Vitamin deficiency. Yes. Now, the patient might present to you saying they have weakness, lack of appetite, they may have anemia, mouth ulcers and also alopecia. These are the important signs which you are going to look for the patient's symptoms and you're going to treat accordingly by giving them vitamins. Let's try to see what are the important B complex vitamins with the names, the disease and the symptoms. Let's go. Vitamin B complex. We know from B1, B2, B3, B5, B6, B7, B9 and B12. Yes, it is very important to know their medical name as well. Vitamin B1 is called as thiamine, B2 is going to be riboflavin, B3 is called as niacin. Please chant with me. B1 is going to be thiamine, B1 thiamine, B2 riboflavin, B2 riboflavin, B3 is going to be niacin, B3 niacin, B5 is going to be pantothenic acid, B5 pantothenic acid, B6 is going to be pyridoxine, B6 pyridoxine, B7 biotin, B7 is going to be biotin. Please remember we have B9 which is going to be folate, B9 folate, and then B12 is going to be cyanocobalamin, B12 cyanocobalamin. Easy. So please try to remember the names of the vitamins. Now, what are the deficiencies? Vitamin B1 deficiency can lead to Wernicke's encephalopathy and also Wernicke's-Korsakoff syndrome. Wernicke's-Korsakoff syndrome. They lead to a condition called as what? Beriberi. Yes. Very important MCQ. Vitamin B12, what is it called as? It is called as riboflavin. Riboflavin. If you have memorized, comment saying that you have memorized. It's very, very important. This box can definitely help you to get 1 mark. Yes. Now, vitamin B12 riboflavin can lead to what? Chiliosis, corneal vascularization, and also angular stomatomatis. All these are going to carry that 1 mark for us probably. Vitamin B3 niacin deficiency can lead to pellagra and also 4Ds. What are the 4Ds? They could be dermatitis, diarrhea, dementia, and if not prolonged treated well, it can lead to death. These are the 4Ds of pellagra. Next, we have vitamin B5 pantothenic acid can lead to burning feet syndrome. Another important point, it could be due to what? Adrenal insufficiency and also distal paresthesia. Pyridoxine deficiency can lead to sideroblastic anemia, has been asked in the exam. It is due to the impaired hemoglobin synthesis and also can lead to convulsions and also hyperirritability. Yes. Next, B7 biotin can lead to alopecia. Another important point, B7 lead to alopecia. B9 folate deficiency can lead to megaloblastic anemia. Megaloblastic anemia, very important. And then we have cobalamin or methylcyanocobalamin, which can also lead to megaloblastic anemia. Let's revise once again. B1 deficiency leads to beriberi. B2 riboflavin deficiency leads to chiliosis or angular stomatomatis. B3 niacin deficiency leads to pellagra. B5 pantothenic acid deficiency leads to burning feet syndrome. Revise B complex in short. Let's revise B complex again. B1 deficiency, thiamine deficiency leads to beriberi. B2 riboflavin deficiency leads to chiliosis and angular stomatomatis. B3 niacin deficiency leads to pellagra. B5 pantothenic acid deficiency leads to burning feet syndrome. B6 pyridoxine deficiency leads to sideroblastic anemia. B7 biotin deficiency leads to alopecia. B9 folate deficiency leads to megaloblastic anemia. B12 cobalamin deficiency leads to also megaloblastic anemia. Please comment if you have memorized straight away now. That's going to be helping you to carry 1 mark, which is going to also save our life. Not all fruits are very expensive in India. Lemons are very cheap. Oranges sometimes are easily affordable as well. So it is very good to drink more of fruits which has citrus in it, which will help you to keep hydrated more and to get what? Especially vitamin C. Very good. Vitamin C is called as what? Ascorbic acid. It is called as ascorbic acid. It is also a very good antioxidant. It helps to facilitate iron absorption in the body. Helps to facilitate iron absorption in the body. So what happens if there is vitamin C deficiency? It can lead to swollen gums, easy bruising, and also petechiae. These are the 3 important points you're going to remember for the exam. And most often, what do we get? We get vitamin C tablets in the chewable form, which is taken once in a day in the morning. Yes, it has to be chewed, not bitten. Okay, good. Next, zinc is also a very important mineral. Zinc is a very important mineral in the body which helps 100+ enzymes. It is going to be required in minimal, but it does an enormous job to the body. Yes, if it is deficient, it can lead to delayed wound healing. Very important. It can also cause suppressed immunity and acrodermatitis enteropathica. For someone with zinc deficiency, we will give what? Zinc acetate. So these are the important points that you're going to remember for the exam and also for your life. For vitamin, it's going to be very important for our life. Vita means what? Try to comment your answers. This is Dr. Auroraj. So this vitamin chapter probably will help you to fetch 1 mark. Therefore, I kindly request you to just go to the video when you have any doubts in the future. Try to make sure that at least this topic is an easy topic and that you're going to get that 1 mark. And also try to treat your meals with good vitamins, for vitamins help you to have a healthy life. Ciao. Love you guys. Take care and study well. Thank you so much.